she got invited to be part of a Mauli Ola Surf Experience Day.
Pictures or videos?
And I think we will hear from her that it has done wondrous things. But we'll let her tell you all the details. Ladies and gentlemen, please welcome, give a round of applause for Erin Hoyt.
Yeah.
Go over there and film. Go over there.
I'm gonna pick out.
Hi, I want to thank everyone here tonight for allowing me to tell my speech and tell my story. My name is Erin Hoyt, and for those of you who don't know, cystic fibrosis is a genetic disease that produces a thick mucus in some of the organs in our body, mainly the pancreas and the lungs. In our pancreas, it makes it hard for us to digest our food, leaving a lot of us malnourished and underweight. In the lungs, the thick mucus leaves such a great place to breed bacteria. You just get infection after infection. I personally have had about 30 pneumonias in my life. And unfortunately, it is a progressive disease. So after you have so many infections, the antibiotics that they use to treat you can often become resilient to your body, which left me to have to get a double lung transplant in February of 2016. My lung function had decreased only 15%, and I was living on full-time oxygen. I couldn't walk more than 5 yards without almost doubling over. I had become a skeleton myself. I went from being a 25-year-old college graduate living on the beach in San Diego to living in my high school bedroom at my parents' house, being supported by them. But that's not who I always was. I like to think that I grew up a pretty normal kid. Of course, I had to take all my enzymes with my meals. And I did do my breathing treatments, which were honestly sporadic at best. I wasn't hospitalized until I was 17 years old, which is so rare in the cystic fibrosis community. As you heard, most kids grow up in and out of the hospital. I didn't actually realize how rare it was until that first time I was hospitalized, and everyone there knew all the staff by name. The nurses were like their family. I was considered one of the lucky ones. And people always ask me, how did you stay so healthy for so long? And the answer is swimming. When I was 5 years old, I started swimming competitively. Soon enough, I was beating kids who were 3 years older than me, and when I was 7, I started swimming competitively year-round. 11 months out of the year, I was practicing 2 to 3 hours a day, 6 days a week. I was qualifying for the Junior Olympics and meets all over. I honestly dreamed that one day I would become an Olympic swimmer. But as I got older, my outside interests developed, and I was burned out on the sport, honestly. I couldn't do it anymore. And so when I was 17 years old, I quit swimming. It was not a month after that I was hospitalized. I quit swimming, and my body quit on me, honestly. After that, my life changed. I was no longer considered normal. I did go to college. Unfortunately, I did not get the normal experience of having a dorm room with a roommate and all that. I had to have a single room so I could do my treatment for 2 to 3 hours a day and to minimize exposure to germs. I graduated college, and when I walked across the stage that day, I had an IV in my arm because I had been in the hospital a month prior in the ICU on a breathing machine. Unfortunately, I never fully recovered from that incident. My lung function continued to decline. I would spend hours a day doing treatment and nothing was helping. I would sleep for 16 hours, wake up, do my treatments, eat, and go back to sleep. That's all I had that energy for. So in November of 2015, I was rushed to the hospital, barely conscious, due to low oxygen levels. My lung function at that time was 15%, and that's when they decided I was going to be listed for a double lung transplant. I was listed at number 4 on the transplant list because I was so sick. And I only had to wait 3 months for new lungs. I still remember the first time I woke up after surgery and could breathe on my own. I was just in shock. I asked my parents, is this how you guys have been breathing your whole life? Like, I had no idea people could just breathe like that. I'm like, no wonder everybody can go to work in the grocery store in 1 day. Like, that's normally a 3-day thing for me, so much energy. And it was just, I was so shocked. I went to cough just out of pure habit, and there was nothing there, no mucus or anything. And it was just, I could not believe that these were my new lungs. But what people don't understand is that a transplant is not a cure for cystic fibrosis. It is trading in one set of problems for another set of problems, new medications, new regulations. After transplant, you're at a 30% higher risk of skin cancer. I developed diabetes because a lot of the medication raises your blood sugar. And also, just like with your old lungs, you have to strengthen your new lungs. So what did I do 5 months after my transplant? That's right, I started swimming again. I got back in the pool, I started training, and my lung function, it increased to 75%, which to me felt like 175% coming from 15. And I found out about the Transplant Olympics, which is where people from all over the world who have had transplants go to compete. So I entered and I trained. I was gonna swim in them. So this past summer in Spain, I swam in the Transplant Olympics. I entered 7 events and came back with 7 medals. I'm not telling you this for the applause, but just to show you what the strength of being in the water and swimming can do for people with cystic fibrosis. It kept me healthy for so long before, and then it kept me healthy again. It boosted my lung function after transplant. I was back in the water feeling better than I ever have, and I finally did accomplish my dream of becoming an Olympic swimmer. So when I found out about this foundation and what they do for kids with cystic fibrosis and getting them in the water and surfing and swimming, I knew it was something that I needed to be involved with. I attended my first surf day this past week, and I was so inspired by all the kids out there just swimming and surfing, the surfers, the volunteers, everyone out there was great. I hope everyone sticks with it, because if I had one piece of advice for anyone out there with cystic fibrosis or anything, I would just tell you the wise words of Dory and say, just keep swimming. And I think now I'm going to show you a short film about another amazing young girl who will show you what the power of water and surfing did for her. Thank you.
Ladies and gentlemen, give it up one more time for Aaron.